As you've rightly pointed out, this condition has a major impact on people's life and also their family and other relatives. Leber's optic neuropathy, also known as LON, LHON, tends to affect young men in their 20s and their 30s. Women can also be affected, but as you know, this is a disease predominantly of young adult men. So there are many aspects to dealing with this question. There's no doubt that this is a major life-changing event for the person involved and for people around them. The first thing to realize is that very often there is a diagnostic delay before the diagnosis of Leber's optic neuropathy is made. It can be up to 3-6 months or more. So for that period of time, you have a person who's rapidly losing vision in one or both eyes by the time they get seen. Very often they see physicians who have not heard of Leber's optic neuropathy before, who are not aware of this condition, and all kind of various other diagnoses are considered. Multiple sclerosis, brain tumors, other forms of inflammation. They get sent from specialist to specialist. Various tests are done, including invasive tests like lumbar puncture. Various treatments are given. And you can imagine how the stress is building, how there's frustration that there is no clear diagnosis yet. So the diagnostic delay itself can lead to a lot of problems for the person involved and for the rest of the family. Fortunately now, diagnostic testing for LON is widely available. Certainly in China, you have a very good genetic setup, and therefore, once someone thinks about the possible diagnosis of Leber's optic neuropathy, you can request genetic testing. Once the diagnosis is made, then of course this is a major shock, for the person who's affected and for the family and other family members. The reason for this is that unfortunately, as you've just mentioned, the prognosis is very poor. Some people can get spontaneous visual recovery, but for the vast majority of patients, they're going to be registered legally blind for the rest of their lives. So this is something for the person to absorb. It can be very hard, in the acute phase, because imagine being someone in their 20s, fit and well, having their whole future ahead of them, and then suddenly they end up going blind in both eyes and being registered as being legally blind. So it's a huge shock psychologically to the person. It has major impact. It might be someone who's a teenager, still at school. What happens in terms of educational adaptations? It could be someone who's just out of university and therefore it might have to change course, might have to change career direction. It could be someone who's already established in their careers and then they can't do their job anymore. So there's possible loss of employment, loss of financial resources, and very often they feel they become a burden to the rest of the family, right? Now, if you go beyond this, now you have the other family members. As you know, Leber's optic neuropathy is transmitted down the maternal line. So the genetic change will have been inherited from the mother. And therefore, for the mother, you can imagine there's very often a feeling of guilt that they've given something to their children, and that has led to them losing vision. And then there are other family members. If you think about this young man who's been affected, there might be other brothers and sisters. The brothers will be at risk, at very high risk, depending on how old they are. The sisters probably will not lose vision, but the sisters might have children of their own, and therefore now they are worried about what will happen to their own children who have inherited the genetic change. So it has ramifications for the entire family. So I think these are just the various multiple layers in how Leber's optic neuropathy has an impact on the patient who's affected, the other family members, and then as time goes by, other things can become more problematic because if you have someone who's lost his job, who's now more dependent on other family members, then the other family members will have to sacrifice their time to look after them or help them with an impact on their own lives. And that's the reason why we've been so keen over the years to look for better treatment for this condition. We've been very fortunate in England that we have a very good national referral network for patients with rare diseases, including Leber's optic neuropathy. There are challenges when it comes to establishing the epidemiology of a rare disease like Leber's optic neuropathy, because there can be a number of ascertainment biases. But we've been able to do that in a defined geographical area of the northeast of England. And based on this epidemiological data, the prevalence of Leber's optic neuropathy was estimated at being roughly around 1 in 30,000 of the general population. If you consider the population of the United Kingdom, where I'm based, is roughly around 70 million, you would expect roughly around 2,500 patients who have been affected with visual loss from Leber's optic neuropathy. So Leber's optic neuropathy is a rare disease, but it's not an ultra-rare disease. And therefore, you will probably roughly have around 20 or 30 new patients per year in the United Kingdom. As I've mentioned already, the key challenge is coming up with the diagnosis, and therefore thinking that someone presenting in front of you with bilateral visual loss could have Leber's optic neuropathy. This is the first key educational aim. The second thing is, once you have this potential diagnosis in mind, of course, if you're seeing someone for the first time, you have to exclude other possible causes of this. You might have to request an MRI scan, you might have to do other blood tests, but let's assume that it's pretty clear-cut that the clinical history strongly suggests Leber's optic neuropathy, sometimes in the context of a family history. So the first thing is to request genetic testing. Very often, the labs will check for the first 3 primary common mutations that cause Leber's optic neuropathy. They are known by their numbers: 3460, 11778, and 14484. By far, the 11778 mutation is the most common one out there, probably accounts for around 60-70% of cases of Leber's optic neuropathy in the white Caucasian population. And actually in China, in Asian populations, the 11778 mutation ND4 accounts for a higher proportion, closer to 90% of the lung population. If you request the genetic testing for these 3 common mutations and it's negative, and you have a very strong suspicion that it is lung, then you can ask the lab to do whole mitochondrial DNA sequencing for you, and sometimes you will find some rarer disease-causing variants. So let's assume now you've done genetic testing and you have confirmation. The next step is, of course, having a good discussion with the patient and with the family, provide them with genetic counseling about the key features of the disease, the poor visual prognosis, the maternal inheritance, and then now what do we do in terms of potential treatment? As you've mentioned already in the introduction, there is limited treatment for Leber's optic neuropathy. In Europe, there is a drug called idebnone, sold as Raxone from Santhera Chiesi, which has been approved by the European Medicines Agency for the treatment of Leber's optic neuropathy. With idebnone, we know that only a proportion of patients will get some visual benefit. For those getting the visual benefit, it will very often it will not reverse things back to normal, but it can improve the final visual outcome. So there is one treatment, at least in Europe, which has been approved for the treatment of Leber's optic neuropathy. Now, of course, this is the only first step, because we need to find better treatment that can stop the rapid loss of vision in this condition. We need to find a treatment that can improve the final visual outcome, not only for a group of patients, but for as many patients as possible. And that's the reason why these programs or gene therapy have emerged in various parts of the world. Because let's face it, this is a genetic disease. The most obvious way to treat this is to try and approach it and deal with the root cause of the problem. So in this case, let's take the 11778 mutation as an example, because it's the most common one out there. If you have a defective ND4 gene, why don't we reintroduce the gene into the cell so that the protein can be produced, and then this can protect your retinal ganglion cells and protect your optic nerve from further damage. The reason why this has been quite complicated is because it's not easy to transfer genetic material directly into your mitochondria. So it is very difficult to introduce genetic material directly into your mitochondria. And that's the reason why people have come up with this alternative strategy known as allotopic expression, right? So you use a viral vector. What we're using now is an adeno-associated viral vector, serotype 2, AAV2. The AAV2 viral vector introduces the ND4 gene into the nuclear genome. It produces the mRNA, and then the protein has a mitochondrial targeting sequence, which allows the ND4 subunit to be imported into your mitochondria. So this has proven very successful in preclinical studies, and there are 3 groups worldwide that have led these gene therapy programs. There's the group of Professor José Sahel in Paris, Professor John Guy in Bascom-Palm, and Professor Li Bin in Wuhan. And over the past decade, these 3 groups have really pioneered gene therapy for the 11.778 mutation. And a number of studies have been published so far, especially over the past 5 years, and it's looking very promising in the sense that replacing the defective ND4 gene results in an improved visual prognosis for patients who are treated. So these studies are still ongoing. Having said that, in science, it's always about not what has been achieved, but what are the unanswered questions. So there are still ways that we need to improve gene therapy for Leber's optic neuropathy. The first thing is, how do we improve the efficiency of these retinal ganglion cells being transduced with the replacement ND4 gene, right? So a lot of people work on better viral vectors, on better ways of getting the gene into the cell. So I think this is something that we need to look into for the future, right? It is also clear that just replacing the gene is not enough, and therefore one can think about various approaches in the future where not only do you replace the gene which is defective, in this case ND4 for the 11.778 mutation, but you can also introduce the gene for other protective factors like brain-derived neurotrophic factor. So these are the ways that we can approach gene therapy. The other thing that we need to consider is what is the timing of treatment, right? As I've mentioned already, very often when you have someone coming to see you in your clinic, weeks, months have passed already. They've already lost a lot of vision in both eyes. And the key question is it already too late? If someone has lost so much of their cells at the back of the eye in the optic nerve, how much can we bring back, from the brink, really? So the timing of intervention is also very important. Because you have to remember that most of the studies that have been done so far have been for people with Leber's optic neuropathy who've been affected for less than 1 year. So the next stage, and that's something that we are also looking into more closely, is very promising results for people in the so-called acute stage of LON, meaning less than a year. What about people who've been affected for more than 1 year, up to 5 years? Can gene therapy also be effective there? So this is what further research need to be looking into. And I guess the final point is, it's really been the focus on the 11.778 ND4 mutation, but there are other mutations, for example, the 3460 and the 1444 mutation, and this is going to be part of future research programs, is how do we approach gene therapy for these other mitochondrial DNA mutations that can affect the optic nerve and can cause visual loss. So I think it's a very exciting time at the moment. The genomic medicine has really flourished over the past decade. We now have the technology, we have better ways of introducing genes, better ways of monitoring the effect of treatment. And the next 5 to 10 years will be very exciting for us working in the field of rare disease and specifically in the field of inherited optic neuropathies. And I'm very much looking forward to what various groups will be coming up in the next few years.